The purpose of this orientation is to teach the value of Histologic's new standard of care for colposcopic biopsy and tissue sampling. Our products allow for a minimally invasive approach to colposcopy compared to what was historically traumatic. The devices are patented, fabric-based, and are called the Soft Biopsy and Soft ECC, and the Bristle-Based Brushed Spiral Brush CX. Kylon fabric-based biopsy devices were designed with the patient care experience in mind. These devices are easy to use, cost-effective, efficient, and will provide laboratories with abundant tissue using a new method that assures tissue trapping. This helps standardize the specimen yield and the method. How do we measure the value of a new medical intervention method or device? Remember that high quality is assumed by patients, clinicians, and payers of healthcare services. And now research proves minimally invasive devices meet the high quality standard by providing reliably consistent and diagnostic samples. Value is added when the new procedure or device provides a service that is also convenient and easy to use, disposable or medically recyclable, all the while being gentle and barely perceived by most patients. Improving access also means improving efficiency in the lab in the clinical office setting. The labs find it easy to process the samples with rapid throughput from receipt of the sample to histologic diagnosis, and the clinical staff appreciate the fact there is no cleaning or restocking of supplies. All this value and benefit results while the minimally invasive devices still remain affordable. Let's begin to understand why the new fabric or bristle brushes are high-quality alternative to the stainless steel punch or curette instruments that cut and scrape to achieve a biopsy. The round-shaped fabric pad on the soft biopsy tip and the diamond-shaped pad on the ECC, soft ECC, both remove and simultaneously trap and store the tissue for later processing in the lab. Thus, the product has 2 FDA registrations as a gynecologic biopsy device and as a pathology supply tissue trap container, and thus is considered 2 devices in one. The patented method behind Kylon is that the hooks only rake away tissue fragments when they're pressed backward and deflexed, exposing the shallow, stiff tip to the tissue. Then pressure on the tissue like light toothbrushing achieves the needed force to do the biopsy, while rotation sweeps the fragments into the hook rows that trap and store it for transport to the lab and later processing. The soft biopsy device is made of plastic with a flat-ended trumpet-shaped tip covered in Kylon fabric hooks. The tip is nearly a half an inch in diameter, much larger than the tip of most punch biopsy forceps. It's an efficient tool as it rakes, removes, and simultaneously traps the mucoid tissue. The same rules on biopsy regarding the use of the punch biopsy forceps apply to these devices. Thus, avoid in scenarios where bleeding is likely, such as coagulopathy and potential cervical infection. Follow the same guidelines for cervical biopsy and pregnancy. The procedure is straightforward. The colposcopist presses the device on the lesion similar to toothbrushing, then performs 3 complete clockwise and counterclockwise rotations, or 6 half rotations in each direction, like key turning. When the procedure is complete, the tip should be inspected and should contain or be filled with mucoid blood-tinged tissue. The colposcopist will view the area of the cervix that was biopsied, which should have a micropunctate abrasion appearance with minimal bleeding. Finally, the tissue-filled tip is snapped free from the handle at the scored area. Then the tip is placed into the fixative vial for transport to the lab. The soft ECC is a plastic single-use device with 1 flat-sided diamond-shaped tip covered in Kylon fabric hooks. The tip is nearly a half an inch long and 1 millimeter in the tip, which broadens out and becomes wider than the tip of a Kevorkian curette. It's an efficient tool. It also rakes, removes, and simultaneously traps the tissue from the canal. To perform the soft ECC procedure, one should orient the device so the fingertips can insert the device and facilitate rotation. Be sure all, or nearly all, of the pad is gently recessed in the canal. Use the shorter ECCS version for shallow or stenotic canal openings. Rotate the device while being sure the fabric hooks are splayed inside the canal. For looser patulous cervical canals, the colposcopist may have to press the hooks onto the canal while they rotate the device, with pressure similar to toothbrushing. This is a graphic representation of the rotational debonding that occurs as epithelium is removed from stroma. The device fills with tissue. Once removed from the patient, the tip is snapped free from the handle at the scored mark and inserted in formalin preservative for histological, not cytological sampling. This is a true biopsy sample trapped within the hooks. The Diedrich research reference proved that fabric ECC, although minimally invasive, removes and collects more tissue than the conventional cutting Kevorkian curettes in the same Colposcopic research cohort. There is a higher chance the specimen will be diagnostic. These are different views of the standard soft ECC device, and below the lighter blue colored shorter pad soft ECC S device for shallow cervixes. This is a photomicrograph image of an abundant multi-tissue fragment resulting from a full thickness soft biopsy, frictional biopsy, and tissue trap collection procedure. This is a photomicrographic image of an abundant soft ECC sample with the glandular and squamous elements. Let's now move to the bristle brush device. The SpiroBrush CX is a time-honored flat spiral stiff bristle brush that gently punctures the outer cervical tissue, then with rotation grinds and scrapes away cells and thick tissue pieces, some of which are collected in the bristles and processed later in the lab. The colposcopist targets the biopsy area with the lesion and presses firmly with pressure similar to toothbrushing. Then rotates the SpiroBrush 3 revolutions clockwise and counterclockwise, or 6 half revolutions each way, like key turning. The mucus, cells, blood, and some tissue become collected between the spiral bristle array. The tip is snapped off the handle and placed into the fixative for transport to the lab. Avoiding trauma, pain, and bleeding leads to satisfaction and patient loyalty. Our technology provides a gateway to better serve patients with what we call compassionate colposcopy. To better understand this benefit, let's quickly look at the conventional stainless steel cutting instruments that these devices replace for comparison. With the gynecologic punch biopsy forceps, the colposcopist must press and crimp a single piece of tissue, then shear it off, leaving a crater that must be controlled for bleeding. Research shows that most patients experience moderate pain from this procedure. The rectangular tip Kevorkian curette tip must be fit or forced into a round or oval canal, then inserted and withdrawn repeatedly like a cheese grater. This is very painful for the patient, usually, to endure, and the bleeding can be excessive. Colposcopists may avoid performing the procedure due to the trauma or scrape too lightly to avoid discomfort, potentially obtaining a substandard specimen or even skipping obtaining the canal sample entirely, thus compromising the ability to make the correct diagnosis. The Winter reference proves that fabric-based biopsy devices remove full-thickness diagnostic samples while also being a less invasive approach. There was significantly less bleeding and pain for soft biopsy compared with the punch, and significantly less pain for soft ECC compared to the Kevorkian curette. The Monk reference on SpiroBrush proves that the bristle brush biopsy requires less need for hemostasis than the punch biopsy. Less trauma defines histologic's mission to advance compassionate colposcopy. Patients with a better experience are proven to tolerate more biopsies and be compliant. That means they are more likely to return for follow-up care. A better experience can also enhance quality. Over a dozen research studies have advised more biopsies should be done, and curettage in some cases are necessary in colposcopy, and the minimally invasive approach facilitates this effort. The lab will find the devices user-friendly. The tissue is trapped in the chylon or recessed in the bristles of SpiroBrush and can be removed by the technician, then processed exactly as a small punch biopsy or sharp endocervical curettage specimen would be processed. The last element in our value equation is whether the devices or method improve access. In this case, it means affecting both clinical and lab efficiency. Removing tissue from a broader area of the cervix in a rapid manner means single rotational effort can overcome mistargeting of lesions in some cases. The hooks are designed to trap the tissue that is removed and retain it in the device for transport to the lab. Disposable devices are always available, which means there's no waiting or cleaning or restocking of metal reusable tools. That saves time and expense. To repeat, the lab can easily remove tissue and process it without special techniques. All the minimally invasive tools allow easy removal of tissue for processing, more so with Kylon because the tissue can be wiped, tweezed, scraped, or combed off the hook's rows in seconds. The spiral bristle brush wire must be unwound first, then the tissue scraped or plucked from the bristle tines, taking a minute or two to perform. The tips or the handle of the forceps or the face of the scalpel blade can be used to release the tissue from fabric hooks with sweeping motions back into the vial or on filter paper. Alternatively, a disposable comb can be used to remove the specimen from the fabric in a matter of seconds under the vial or on filter paper. For processing spiral brush samples in the lab, please refer to the standard operating procedure to unwind the coil and scrape free the specimens from the bristles. In conclusion, when patients don't experience trauma, a colposcopist can take more needed biopsies and make the correct diagnosis, and engender trust and compliance with care. Early detection can mean earlier treatment, which is good for all concerned, including the payers of healthcare, such as patients, the government, and insurance companies. All the while, this is being done with a gentle touch under the lab's quality assurance. The lab's audit results and is the ideal partner for the colposcopist. If you have any further questions regarding Histologic's product line, the value of the new technology brings to women, or if technical questions arise during the use, distribution, or sales, please note the following contact information, and thank you for your attention today.